So what can we do to prevent negative palmar angle? Sometimes we want to blame the farrier, but in reality, sometimes the farrier doesn't know what's inside the foot. Sometimes the farrier needs a little help, especially in certain cases, are prone to get negative palmar angle. It's just so common to say, oh, the farrier didn't trim it properly, but there's a lot more that goes into having a negative palmar angle. The tension on these ligaments that you see here increases and lameness can occur. You can see this joint over here gets significant pressure because that joint is so susceptible to the angles that are happening in the foot. Hey guys, I had a really cool case today and we're gonna do something slightly different. I'm gonna show you the case as I work in it on the radiograph machine. So we're gonna call this the negative palmar angle. So if you look at this foot, right here is the foot of the horse. This is the P3, P2, P1 navicular. We also call this third phalanx, second phalanx, first phalanx, and navicular bone. By the way, if you want to learn the anatomy of the foot, I created this booklet called Equine Foot Secrets. You can get it at Amazon. This is a booklet that I created for horse trainers and owners. It's relatively basic, easy to understand, not scientific terms, because I get so many questions all the time on what's in the foot, and sometimes we get into really high level terms, and I wanted to keep it simple but very informative. And if you look in page 3, chapter 1, we talk a lot about the anatomy of the foot. It's actually an excellent chapter. I have a lot of graphics that are very, very helpful. So back to our case over here. We have what I call a negative palmar angle. Why do I call it negative? Because look at this green line. Positive angle, negative. If this bone would have been here, that would have been a positive palmar angle, and that would have been more normal than on a negative stand. Let's go right here. Look at this left hind foot. The left hind has a flat, you see this line is flat. This is what we call a zero or slightly positive right there. So how do we fix this? This is the negative palmar angle. Or another question is, you can ask me, hey, why is this bad? Well, the reason this is not ideal is because imagine if you're walking, stretching your hand like that every day. Your tendons in the back part of your arm are going to start hurting, and also the joints. And if you see in the anatomy of the foot right here in the book, Equine Foot Secrets, that there's a lot of tendons right here, soft tissue. And that soft tissue, you're not going to see it on x-rays or radiographs. Those are going to get overstretched because the foot is going like that. So what we do is we trim it in such a way that we correct it. Good news, this particular horse has a lot of foot to work with. You can see right here, look at this significant amount of foot between the tip of the bone and the sole right here. A lot of foot. This is very, very nice. There are multiple ways to do it. Some farriers are going to try to use pad, which is okay to put an elevation pad. There's a lot of foot here. Probably trimming will be enough. The right way to do it is do proper trimming, right? Because the foot is super healthy. There's a lot of foot in here, and we can help a lot this horse. So we're going to do maybe 1 chewing cycle and it be fixed, maybe 2. Sometimes some horses are so bad that they require 3 chewing cycles. And after we do that, then the chew can actually do the job, but the trim is the most important. The chew doesn't do its job unless the trim is properly. So we're going to take this horse, we're going to trim him properly, and then we are going to put a shoe afterwards. And then after we do that, it's going to go and start performing. In another video, I'm going to show you the post chewing job. So what can we do to prevent negative palmar angle? Sometimes we want to blame the farrier. Oh, my farrier didn't do a good job. But in reality, sometimes the farrier doesn't know what's inside the foot. Let's look at the outside of a foot. This is what the foot looks in the outside, right? And look at everything that's on the inside. Not always the farrier can just magically know exactly what's going on inside that foot. Sometimes the farrier needs a little help, especially in certain cases, are prone to get negative palmar angle. Yes, it's just so common to say, oh, the farrier didn't trim it properly, but there's a lot more that goes into it, into having a negative palmar angle or this phenomenon. Why does it happen? Multiple times the farrier goes to look at the shoe, look at the foot, but doesn't know what's inside. So trim it according to what he thinks or she thinks is best. And then over time, continues decreasing heel, taking heel off. And if you can imagine, we keep rasping and rasping and rasping. And then over the months, over the years, it becomes negative. The tension on these ligaments that you see here increases and lameness can occur. You can see this joint over here gets significant pressure and tension because that joint, the coffin joint, is so susceptible to the angles that are happening in the foot. So that becomes also a problem. Then you might have a horse that you're injecting over and over again because they develop arthritis or inflammation in the joint, and sometimes a simple joint or proper trimming can actually fix it. So how do we correct it? Way to correct it is first we suspect it, right? The veterinarian will determine, yeah, the lameness might be on the foot. We take radiograph, and then after that, we tell the farrier, this is what we got. Then we go and we continue taking radiographs for the farrier until we have achieved a positive palmar angle. So we cannot just, I usually don't just go and tell the farrier, okay, this is it. I want this corrected. No, I usually take more radiograph until the farrier trims and keeps correcting. So in this particular case, the farrier actually shows to put a pad. The farrier, you can see that there is a wedge pad in here. This could be controversial and it's not always done. The farrier decided that it was the right thing for this horse for now, and eventually we'll take it out. Let me show you why. Look how this radiograph look like right now. This is no longer on such a bad negative palmar angle. So this is the end product of the first showing. You can imagine that when we do second showing, third showing, then we're going to start removing the pad, trimming, and getting him more in a physiological, normal angle. So if you have a horse with a negative palmar angle, just recommend taking some x-rays and then showing with radiographic guidance. That is the absolute best. If you need help, we can help you out. Come give us a call and we're right here for you.